Hey guys, it's Functional Fitness Friday and I'm Dr. Rick. And last week we went over the rotary components of functional movement with the straight arm core rotation. This week we want to continue on that theme with a little bit more involved complex exercise, the trailing arm core rotation. So when teaching this exercise, there's a lot of stuff going on here. How to start teaching it is feet are about shoulder width apart, knees slightly bent. You're going to bring both arms towards one side and rotating your head towards the same side. The hips are a little bit rotated, the core is engaged and nice and stable, and the cervical and thoracic spine are rotated towards that side. And what you're going to do is hands are going to stay in the water. You're going to be about chest deep in the water, and you're going to open following with the head and then trailing the other arm across to meet, and then opening, rotating with the cervical spine, and then coming back here. So there's a lot of stuff going on here. You got cervical spine rotation, you got thoracic spine rotation, you got hip rotation, and you got a lot of core stability to resist that rotation. If you want a progression from here, you can use a foam bell, you can use a resistive bell. I like to use the Aqua Strength bells because they give you some nice smooth resistance. And how you would do it with this, again, keep your wrists straight, keep your hands nice and loose, so you're not getting any flexion extension with the bell, so it's nice and neutral. But again, this is a lot of load to progress to, so start slow. You could do one bell and then increase it to two bells, but you're here and you're opening and then you're closing. Compensations with this exercise typically, and I'm sure there's more, but typically is that people are going to open and then rotate the head later. So you really want to get that really coordinated pattern. People also are going to be twisting from the lumbar spine like we talked about. And people also, especially when you have an external load here, they're going to be flexing their biceps a lot to try to really resist that long lever arm coming through the water. Last week I had a great question from Brooke in Australia, so shout out to Brooke. And she was saying that when she was doing the rotations with her clients, some of them would complain of some inner knee pain or their foot would come off the ground, and is that okay? And I said, if they're substituting in that knee or foot, I would really probably look at the thoracic spine mobility, the hip mobility, the ankle mobility, and see where that kind of imbalance is coming from. Because the ankle, hip, and thoracic spine tend to be a lot more of a mobile joint, whereas the knee and the lumbar spine tend to be more of a stable joint, or should be more of a stable joint. So a lot of times when you're looking at a client with a knee issue or a low back issue, always look above and below that joint, because that's usually areas that need to be cleaned up. But again, kind of work on that pattern nice and slow. And make sure you get the qualities within the exercise. It's not just the exercise, it's the qualities within the exercise that are important. So I want to show you a video of what this looks like under the water. And if you guys are interested in any aquatic training education programs, whether you're fitness, sports performance, therapy, visit rickmcavoyaquatics.com. And hope you enjoy the video, and we'll see you guys next Friday.